please go ahead and ask any questions you have to our panelists. So go ahead, Shobana.
Yeah, I have a question to the doctor.
Yeah.
What about water pick? Does that replace flossing? Because my teeth are so close, I cannot floss. It's really difficult to floss.
So actually, if teeth are very close together, then flossing would be easier than water pick. Water pick is usually recommended when there's more of a gap so that the water can kind of flush into the open space. No, it does not. To answer your question, no, it does not replace a floss. Nothing replaces a floss. However, it does replace not doing anything.
Yeah.
So if that is your choice, flossing is harder. That is the problem. Most people actually floss incorrectly. So one of the first things I do when my patient comes in is actually teach them to floss, because and perhaps I'll cover that in one of my talks. And unless done correctly, you're basically not doing anything. So in face of that, I would say yes, water pick is perfectly fine, but as far as possible, maybe do both. Maybe 3 days a week do a water pick, and 4 days a week try flossing.
Flossing is very difficult because I have implant, I have bridge, I have crown, and they're so close. I cannot even floss. So it's very difficult.
So if water pick is working, and let's say when you go for your checkups, you don't have cavities and such in between your teeth, then it's great. It's working for you. Then it's fine. Then I wouldn't change anything. However, if cavities are discovered, then I would change from water pick and then start maybe flossing. It's actually something called a floss threader. It's like a needle, and you have to put the floss in it and then kind of go from under.
Yeah, I have it.
Yeah, those are usually the ones used then.
No, between my teeth, I cannot put the thread, floss, because it's so close. So that's the thing.
Yes, so in that case, water pick is good. Yes, it will force the food out.
Okay, thank you.
Dr. Said, what is the sequence it should be the better? Like, brushing, flossing, water pick. So which way, what do you do first? A lot of people have different ideas. So I just want to know which way is the better.
So my suggestion is, firstly, you should be brushing twice a day. So mornings, usually when people are in a rush, if possible, you can try and brush after your breakfast, so that you have now removed not only the night's plaque, but also whatever you've eaten from breakfast. If that is not a possibility, or it's something that you don't care for, then you can brush before breakfast. And I had addressed this last time as well. I absolutely recommend electric toothbrushes. So you would use your electric toothbrush. I personally do not floss in the morning. I'm too much in a rush. And flossing cannot be done when in a rush. The brushing should go on for about 2 minutes. Then you rinse your mouth and you clean your tongue with the tongue cleaner, not the toothbrush. And that's that for your morning. If in the afternoon, after you've eaten, if you have a toothbrush handy and can brush, great. If not, just rinse your mouth. It's not essential to brush at that point. At night, you do want to brush, then floss, and then clean your tongue.
And when do you use the water pick?
So it's either floss or water pick. It's one of the two. So or brush, water pick, clean tongue.
Okay.
So in that order, brushing usually comes first. You don't want to, you want to remove all the majority plaque with the brush, and then go in and do the finer one with either your your floss or your toothpick.
Yeah, because in the morning I brush 4 times a day. Before breakfast, after breakfast, after lunch, after dinner.
Oh, wow. Okay.
But the only thing, since I started using the water pick, my dentist said my gums, my gums are always had been good, but she said now this is much more healthier and much better.
Excellent.
And I really like it. And because if I don't do that, I feel like something is wrong. And same thing with the cleaning the tongue. It's always been like brushing, clean the tongue, and the water pick.
Yes, exactly.
But I have another question. But what I have noticed, I'm not satisfied, so I just want to see if everything is clean. So I take the toothpick and I go in every teeth, and there is some white plaque comes out, you know. Once
That is exactly what a floss removes far better than you said it, just you hit the nail on the head. That's exactly what a floss removes far better than a water pick.
right. So
Those
what I
little
start doing
tiny
after,
pesky sticky stuff.
right. So what I start doing now, because when I see that, so after the water pick, I do floss, but still I'm not satisfied. I still use the toothpick a little bit. So once in a while from somewhere it comes up, sometimes it does not.
Yeah, and I'm glad you addressed toothpick. On the, on the topic of toothpick, I can't tell you how many dental emergencies I have in the year where the toothpick, where a splinter of the toothpick has embedded into the gum. These toothpicks are not made from the best materials, and a lot of these splinters do sort of come off and get embedded into the gum. So I'm not such a major fan of toothpicks.
No, I have that, you know, the rubber tip.
Oh, the rubber tip. Yes, yes,
I
yes.
use that.
That's different. Yes.
I keep in my purse also. Suppose sometimes I cannot brush after dinner, lunch, you know.
Yeah, yeah, yeah,
I
yeah.
just
That's not a toothpick. The rubber tips are good. Yeah,
rubber tip.
yeah.
Okay, thank you so much.
Of course, my pleasure.
So another question for Nipa. So the question is from Veena. So she wants to know how safe it is to see the dentist in this time. So I believe everybody has this question.
Yeah.
Excellent question. So right now, the CDC guidelines and the ADA, which is the American Dental Association guidelines, prevents us from practicing unless it's a dental emergency. So you should not be seeing your dentist for anything other than pain, swelling, etc., etc. And even then, the first line of defense from our end is always medication. We will try and bring down the pain and swelling with antibiotics, anti-inflammatories, something to that effect. If that doesn't work, we will refer you. There are specialists who are working. They have their N95s and the all the face shields and whatever else, who are following the CDC guidelines. The problem is not all dentists are still equipped with that. We are in the process of doing it. In fact, I'm part of a WhatsApp group which is pinging every day because now we're in the process of buying our masks and all the equipment needed, because dentistry is going to be very different for the next year or two. Unless that happens, we cannot see patients because with the aerosol, etc., we do more damage than good. So it's only these specialists who right now are following CDC guidelines that we would refer you to, and only for emergencies.
Thank you, Nipani. So I think I'll ask the same question to Kusum also. What should be people's take to see the doctors, or if they need something basic?
It's again depends on your county to county. For example, in our county, John Muir is one of the major hospitals, and they have started elective surgeries, and then they started doing antibody testing, which is available. And then in fact, in the other hospital like Antioch, it is more available. So it all depends on your county to county. On the other hand, in our own clinic, and then we have started doing some procedures. For example, endocrinologists are doing the biopsies, and then we do skin tests, but wearing completely protective masks. And then we give the injections in the parking lot, and we do not have the injection given yet inside the thing. So it all depends on place to place, and then the county to county. So the best thing is to listen to CDC guidelines and then follow that, because this is changing, and then every day things are changing. For example, there is a new findings now. It's called happy hypoxia, and then which is you may not have any symptoms. You could be at home, but all of a sudden you don't have enough of oxygen, and then people are dying. So things are changing. It is not the same every second.
Yeah, thank you. So any other questions from anyone? Okay, Aman, go ahead.
Let me first thank Dr. Kusum and Nipa for their very educative guidance. And I have two questions for Dr. Nipa. Number one is, you have already answered my question. I had a full denture on the upside, and it was working perfectly all right. But nowadays, I feel that it has become a little loose because while I am eating, sometimes it has a tendency to fall. So the best way is that polyethylene adhesive or something like that. So I just want to know, I have avoided using it. Is it safe to use that polydent adhesive powder a little in the morning and in the night?
Yes, it's perfectly safe. However, as far as your, how old is your denture?
Oh my God, I am very old.
I'm sorry, your denture. How old would it be?
I am 82, and I am very, very grateful to my dentist. Her name is Dr. Vijaya Lakshmi Acharya. She is based in.
Oh, I know her very well. Yes.
Okay. Now, she gave me the courage to smile, which earlier I could not do that. Okay.
Yeah.
But the problem is now I am okay, and my wife has also got given partial denture last year. Very uncomfortable. I says, you will get used to it. Don't worry. He says, no, it comes off. Is that? I says, the only way is that adhesive, polydent adhesive, little, not much. You just do it in the morning, and keep it there. And in the night time, you take it off. Don't go on taking off and on, then you will have trouble.
Right. I would suggest, at least for the full denture, to do something called a lab reline process, where they just take an impression of the inside. Basically, the inside, the part which is attaching to the bone has changed. So they now need a new impression for that, and they add little material there. So there'll be a new base now. So it'll go to the lab for a couple of days or whatever it is, and then when it comes back, it's a little tighter. And then you can, if you need to, you can continue to use Polygrip or whatever. For the partial dentures should not come out that easily. Then there is something incorrect about the design of the partial denture, probably. Because partial dentures are solely take support from the teeth, etc. So if they are coming out, then something else needs to be looked into. The design needs to be changed or something. But if Polygrip is working, then please go for that.
Okay. This is number one. Thank you very much. And I have to get your address, Dr. Nipa, because I am really scared to go to any dentist over here because the medical cost is so exorbitant, and I am a retired person. I can't afford, just simply can't afford full denture, $12,000, $14,000. I said, oh my God, where from I will get it? So I will go to India and get it done. And that is what I am doing. And second question is that is it necessary? I put it in that, again, that polydent and that what you call Walgreens, some tablet in the water in the night and overnight soaking. Is it necessary to do it daily, or just 3 to 4 days alternatively?
3 to 4 days is sufficient. Just unless you start noticing stuff collecting in your denture, but 3 to 4 days is usually sufficient.
So thank you both, Kusum and Nipa. Thank you very much.